Sir Nicholas Macpherson, who was a top Treasury civil servant, says test and trace, and I quote, wins the prize for the most wasteful and inept public spending programme of all time. Is that unfair?
Well, I don't think it is particularly unfair, because the most effective way, alongside vaccines and reducing contacts and reducing transmission through hygiene and masks, particularly as we come out of lockdown, will be to identify and isolate cases. This is fundamental to controlling the pandemic, and it's fundamental to getting our economy going again.
So what went wrong?
And it's fundamental. Well, yesterday at the Select Committee, Sir Patrick Vallance spoke about this and said that he thought it was working very well. But the chairman of the Select Committee, Greg Clark, contested that. And of course, it's not Sir Patrick's role, actually, to evaluate it. But the claims being made by the Test, Trace and Isolate organisers have been strongly contested by this Public Accounts Committee report that's just come out. And they say it's an unimaginable cost. They say that testing has never met the target to turn around all tests in face-to-face settings within 24 hours. It's not linked with primary care. It's not linked with local tracing, that the tracing system is only picking up about 2 contacts for every 1 case on average. And, if you look at countries in Asia like Taiwan, they pick up 17 cases for 17 contacts for every case. So, overall, Britain has really struggled. We haven't hired enough contact tracers. They haven't been on the ground. They haven't been marshaled efficiently. And the biggest problem is that even when people are told to self-isolate, many of them are not doing so because they're not supported either clinically or materially, locally, or financially. And for all these reasons, the claim that this has been an effective program is contested by the Public Accounts Committee.
So could there have been a way to do it that was A, less expensive, and B, more effective?
Yeah, and there's a great example, which is the vaccine rollout. I've had my vaccine. I don't know if you have, Mark, but you go along to a centre, lots of people there. It's run by the NHS, because we don't have an NHS test and trace. The NHS vaccine rollout is run by primary care networks. It's run by local people, GPs, all linked into their data systems. And look at the result. It's been incredible. Over 90% of target populations in the older age groups have been reached. And we've done it at spectacular speed. We should have done this from the very beginning. People have been saying for the past year, we could have set this up last February 2020. We didn't. We stopped it too soon. We didn't set it up when we got our cases right down in July. And again, it was allowed to come back. We've now got a third opportunity after these 2 further surges. And Chris Whitty was absolutely right yesterday. He was saying, look, I'm really worried because when we lift the lockdown, there's a real risk that there's still 40 million people who are not vaccinated, who are either vaccine hesitant or are children. And so there's a real risk of this coming back again.
But the government sorry to interrupt, because this is an interesting point you just made about vaccines. The government said that they've had time to prepare for vaccines, test and trace. They said that there was not the scope at the beginning for local authorities to get it done. In the interests of speed and getting up and running, they had to use more private consultants. Do you accept that, or was that wrong right from the beginning?
I think it was wrong right from the beginning, and I contest the view that they couldn't have set this up. They had much longer than South Korea or China, who set a program up within a couple of weeks, actually. We could have mobilized public health teams. We had 750,000 volunteers who had recommended themselves last March. We could have mobilized a local system. And when you do it early on in the epidemic, remember last year we stopped contact tracing when we'd had only 10 deaths. Look at the numbers right now. Korea flattened their epidemic when they'd only done, I think, 18,000 tests a day. So when you get it early and when the cases come right down, you can really nip this pandemic in the bud. And I think we could have done it last year. I don't think it was being advised by the scientists at the time.
Right. Look, just only a minute left or so. But if done another way, your way, the way you're suggesting, could it have prevented a second and third lockdown, do you think? Because that's quite key.
Well, most of the successful countries have not actually had national lockdowns. I mean, China locked down Wuhan and Hubei province, but they didn't lock down the country, nor did South Korea, nor did Taiwan or Vietnam. So, we could have done this. I think that we could have saved a huge number of deaths. Whether we would have had another national lockdown is debatable. But I think we need to apply the principles of locally run, engaged public health teams to manage this contact tracing and testing and getting the results back quickly. And that way, we're going to protect our communities in future. And if we don't do that, I really fear that Chris Whitty's right, that we'll have another big surge, despite the vaccine.
OK, Professor Costello, appreciate your time. Thanks for joining us again. Thank you.